Subscribe to our YouTube channel and press the bell icon to get the latest updates.
I'm at the Institute of Child Health here in Chennai in Tamil Nadu in anticipation of a third wave which could potentially impact children more. The government here is conducting training for nurses for pediatric care. The multidimensional training is focused more on caregiving for children and managing parents in case there is a surge in a potential third wave.
The second wave of COVID left most of the states devastated. People were running from pillar to post looking for beds and oxygen cylinders. Anticipating a potential third wave, the Tamil Nadu government is preparing all possible precautions that will help in curbing deaths in large numbers. Some have said that the third wave, if it does come, may affect children. In order to be prepared for this eventuality, the Indian Academy of Pediatrics of Tamil Nadu chapter has started training nurses on how to manage children. There have been virtual classes as well as training sessions being conducted at various medical colleges and institutions. Around 30,000 nurses in the entire state will be trained under this program irrespective of whether they are private or a government hospital. Till now, roughly 10,000 nurses have already been trained. Every day in the virtual sessions, roughly 3,000 nurses participate in these sessions which take place thrice a week for 3 hours. There are 4 modules of training with 15 faculty members for each module. The government plans to finish training for all nurses by the end of this month.
What you now saw was the hands-on training, but we have started this training for the staff nurses to equip them to handle the probable anticipated COVID third wave, which we anticipate children to be affected in little more larger numbers. So we need all the staffs to orient themselves to manage children. So when the adult staffs, the staffs who handle adults, they need to be oriented to manage children. So that is what we are planning to. As the first part of it was, we had arranged for virtual sessions in different modules, like how to recognize a sick child and how to stabilize a sick child, especially with reference to COVID illness, and then how to prevent the contamination and the infection. So these have been planned in 4 modules, and each module runs between 30 to 45 minutes, and every day, 3 days a week, the sessions we started in July 31. We are planning to conduct till August so that we cover the entire staff nurses who are working in Tamil Nadu, in both government sector, private sector, from all levels, tertiary care. But then we want to ensure that everybody participates. So through the directorate, the entire state of Tamil Nadu, we have allotted different colleges, different dates, so that everybody is covered over the different sessions. Maybe some may not be able to attend that particular day, so they can attend on any day. We have just given a schedule to cover the entire nursing population. In case they are not able to attend, they can always overlap with other sessions and they can attend. That is how it's being planned, and it is going on well. Only thing is, hands-on experience in COVID situation is little difficult. So we are planning to do that at the institutional level, wherever it is, either Taluk hospital or the medical colleges or private institutions. We have a panel of trainers and they will train their own institute nurses. That is the way it has been planned.
Dr. Lakshmi, a professor of pediatrics who is also training the nurses, explains why this training is important.
Pediatric children are not half adults, they are entirely different from adults. Managing the airway of the children, the devices which we use for children are entirely different. And so we are, as pediatricians, we have a unique way of monitoring and managing these children. Monitoring, managing, everything is different from that in adults. So though the nurses are trained to look after everybody, we are giving more concentration to because in the third wave we are probably expecting more pediatric cases in the third wave, number of cases. We are training them exclusively for pediatrics. It's entirely different. Now the only problem with the children is that they are not being vaccinated. That is the main problem. We have 18 children, adults above 18 years have been vaccinated. Between next month, probably this end of this month, 12 to 18 years, probably vaccination might come. But less than 12 years, we have not had vaccinations. So that is the main issue. That's why we are a little worried.
Dr. Puarigi explained that the care given to a child is much different from that given to an adult.
New. We are only reinforcing them, and we are just modifying them a little bit so that they are oriented to handle children. Handling a child is a skill for a staff nurse. They are all handling adults. So when they have to handle a crisis situation in a child, they need to make little more modifications in whatever skills they are imparting. That is what we are trying to teach them, because see, the adult becoming sick and a child becoming sick, there is a tremendous difference, because the entire family will be emotional when a child becomes sick. So it's not only handling the patient, it's equally important that you handle the attenders as well. That is what I was trying to tell them. So all those aspects, including the transport and all, have been covered in the modules.
The training focuses on the management of airways, what kind of devices should be used, how much oxygen a child should receive, and basic COVID etiquette. The workshops conducted in various colleges and hospitals have nurses coming in small batches given the uptick in COVID cases. For this session, there were 15 nurses.
It's a crucial period for facing pediatric next third wave. We are facing a lot of problems. It's facing a COVID-19 because this station for everyone's learn about how to handle the pediatric in a COVID situation. In future, we are all in first line. Therefore, doctors we are teaching from how to handle the pediatric, and technique also we provide in front of pediatrics. It's an emergency situation. We are all how to handle the babies or newborn pediatrics only. That's why doctors are teaching about emergency situation for oxygen, how to put on a CPR, and then IV lines, and then hand washing technique.
The otherwise virtual sessions for pediatric care have about 3,000 nurses tuning in. The coordinators, however, say that the hands-on training in person is a lot more valuable. However, due to the surge and an uptick in cases, now the smaller groups are just starting. At the end of one of the sessions, one coordinator said that no child should die at your hands. One has to only wait and see if there is a third wave and if children are more impacted in this potential third wave. Tamil Nadu is now on its way to equipping itself in dealing with this surge. With Manisha Mondol, this is Revati Krishnan reporting from Chennai.